Hi guys, we'll just wait a little bit just to make sure that everyone is in and everyone is able to see, and then we'll get started. Just wait another couple of seconds just to wait to see if anyone else is going to join. Okay, then we'll get started. So, welcome to this talk around non-specific lower back pain. And today we're going to go through what it is, and why it's such a big thing, and how it might be impacting and how it might be causing your lower back pain. So we're just going to talk about a little bit about what it is, a little bit around the anatomy and why, what might be going on, a little bit about the symptoms and what you might be feeling and any causes that it could be, and then finally just sort of how we can help you in our clinic with this issue. Okay, so we'll start with what is non-specific lower back pain. So it's basically a term that's given to any pain in the lower back that isn't attributed to a specific pathology. And what I mean by the word pathology is any sort of condition or illness that could, be contributing to any pain. So anything such as osteoporosis or any spinal fractures or any sort of structural deformity within the area. So whether that's to the bones, the joints, anything like that. Okay, so non-specific lower back pain it's not a serious issue. Okay, that's kind of why it's got its own term, but it can also be very debilitating. So for anyone who's had any sort of lower back pain, that when it gets quite serious, you can find that it can have a massive impact on your life, whether it's to do with any of your like daily tasks, so anything such as cooking, cleaning, taking the bins out, anything like that, or have an impact on your sport and your hobbies can also have an effect. The lower back pain can also have an effect on that. Okay, so it tends to be categorized into three different subtypes, and this is all based on the duration of the pain, so how long you've been feeling this pain for. Okay, so acute non-specific lower back pain, anything less than 6 weeks. Subacute is if you've been feeling the pain between 6 to 12 weeks, and then anything 12 weeks plus is classed as chronic. And like I said, these sort of terms aren't only relate to the amount of time that you've been feeling the pain. It doesn't change, there's no real change in any of the symptoms or any of the treatment. Okay, so lower back pain is such a massive thing in general population. Okay, so there's studies that show it can affect between 60 to 80% of people, and 23 of those people roughly will can have chronic pain, so have had that pain for 12 weeks or more. And also another statistic, it's a large proportion of people with lower back pain. It tends to be this non-specific lower back pain that is given as their diagnosis. So 90 to 95% of all lower back pain tends to be this non-specific lower back pain, and basically, like I said, it just means that it's pain that you're getting from that's not attributed to any sort of condition or illness. So just a little bit about the anatomy of the lower back, and why it's so important and why you may be feeling some of that pain more so than other areas of your back. So the vertebrae within the lumbar spine, you've got 5 of them, and they're the largest vertebra in the spine, because that area of your spine is sort of what's doing all the heavy lifting, if you like. So it's what's supporting the body against gravity, and it's taking a lot of the weight of your upper body and really trying to reduce the effects of gravity. Okay. So it produces movement, so it produces flexion, which is where you're bending down to try and touch your toes, extension, which is where you're sort of leaning back and arching back over, side bending, so where you're bending down to the side. So, if you were to run your hands down the outside of your legs down towards your knees, that would be side flexion or side bending, and it offers a really small amount of rotation, but because of other structures that are on the vertebra, it really restricts that amount of rotation that you get throughout that region. Okay. Within the spine, you also have a natural curve, so it's called your lordotic curve, okay, related to the lumbar spine, and this is very natural to have a slight curve. So it's sort of, if you were to look at it side on, it sort of goes inwards like this, and this is perfectly normal. Any excessive lordotic curve, okay, can increase the risk of any pain that you might be getting. You also have ligaments within the spine that run along the front and the back of the vertebra, and also towards the sides, and this is what's really going to produce that really crucial stability and will resist any excessive movements that can increase the risk of injury. So what might you be feeling if you are worried about this non-specific lower back pain? And there's no sort of real specific symptoms. It's very individual and can vary from person to person, but it tends to be very common symptoms will be some stiffness in the area, a lot of pain. So that pain can be sharp, and it can shoot down into the buttocks and into your legs as well. It can also be quite an achy pain, and you could sort of just wake up with it in the morning and it feels like really, really achy. Prolonged sitting, so if you're sat at a desk for your job, if you're sitting for long periods of time, this can increase your pain, and you can also find that you've got a lack of movement, or you're unable to do all the things that you were previously able to. So whether that's due to pain or due to stiffness, people will tend to find that they are, they're struggling to move as well as they were before the pain started. So some of the causes, so these can be really varied. It can be situations such as a traumatic injury, so whether that's, maybe falling off ladders, road traffic accidents, anything like this can lead to non-specific lower back pain. Any sort of sprains or strains to the soft tissues or the joints in the area, so whether that's a muscle, a ligament, or the joint itself. Any sort of injury to this area can lead to what we know as non-specific lower back pain, and it can be caused by other issues within the body in other areas. So what's known as compensatory patterns for other pain, for other injuries, can be a cause of this non-specific lower back pain. So for instance, we find in clinic that a fair amount of people who have non-specific lower back pain also struggle with having quite weak glutes. That's your big muscles in your buttocks. We find that there's quite a good correlation between weak glutes and also non-specific lower back pain, and also you know, it might be that you've had an injury to your lower body, so whether that's the hip, knee, even ankle, and this has altered your gait slightly, so how you're walking. It can be that, you know, this can then cause excess pressure or excess forces and different types of forces that are put through that lower back, and that can also increase risk of pain and then lead you to potentially having this non-specific lower back pain. Okay, so how can we help? So, you know, if you're sitting here watching this being like, oh, I really relate to a lot of the things that I'm saying, you know, what can we do as a clinic and as therapists? What can we do for you? So the main thing that we can do is really help with your pain and your symptom management. So whether that's, you know, the pain that you're getting, whether it's stiffness, whether it's a lack of range that you're getting through the area, we can really help this. So whether it's through hands-on therapy, so stuff such as massage or you know, stretching, stuff like that, we can really help you with, or specific exercises. So yeah, so, you know, taking you into the gym, giving you some stuff to do at home, to really try and help reduce the pain and manage your symptoms a lot better. Okay, one of the things that I've noticed that has really helped my patients is strengthening their core. Okay, so when a lot of people hear core, they tend to think it's just a six-pack abs. That is, you know, that's what makes up your core, but it's actually you know, it is the abdominal muscles on the front, but it's also your muscles on the side of your torso, also around the back as well. And I've noticed that strengthening these muscles and increasing that stability around the area can really improve and really decrease the amount of pain that patients are in. And also just a really big thing that, you know, is seen in literature as well as in clinic, is just staying active. So making sure that, you know, whilst you can find that this pain causes you some disability and can really impact on your day-to-day life, staying active is a really key and really important thing for you to be doing, and it's seen that it can really improve your pain, and it can really sort of improve your quality of life. Okay, so that's sort of in a nutshell what non-specific lower back pain is, how we can help, and also, you know, how you can kind of help yourself as well. So if anyone has any questions, feel free to pop them in the chat. I'll give that a couple minutes just to make sure that any questions are sent over. No? So if no one has any questions, I will leave it at that. Feel free, obviously, to re-watch this video and pop any questions in the comment if you think of them after, and I'll do my best to get back to you. All right, see you later, guys.